Welcome to Heartbeat OK. I'm Dave Morris here in the Oklahomans Video Studio. This week we will be talking with our friends at the American Heart Association, a couple of ladies here who are doctors, about heart disease in women. It's a very serious matter. Dr. Sonja Hughes and Dr. Elizabeth Pinard. Ladies, it's very nice to meet you. Thank you for coming in this morning.
Nice to meet you.
Heart disease in women is a very serious topic, but before we get into that, let's talk about you ladies. Dr. Hughes,
Yes.
where are you at and what is your specialty?
Hi, I am an obstetrician gynecologist at Integris Health Edmond. However, I only practice gynecology now. And what that means is I do women's health as well as female surgery.
And how did you get into the health business?
Well, when I was 14, my grandmother was diagnosed with cancer, so my determination was to find a cure for cancer. And I decided at that time to become a physician. After going to medical school and doing my rotations, I realized that I loved surgery and I liked more of a primary care based practice. And so when I did the OB/GYN rotation, I was hooked from the beginning. And so I've been practicing over 20 years now and just stopped doing OB and delivering babies about 3.5 years ago.
Wow. Yeah. Wow, I had coffee this morning. I have nothing fascinating compared to these stories that we're about to hear. From Oklahoma?
I'm originally from Fort Worth, Texas. I did migrate to Oklahoma to attend Oklahoma State University, then went on to attend medical school in Nashville at Meharry Medical College. I did my residency at Cook County Hospital in Chicago, and then returned to Oklahoma and actually worked for the Indian Health Service in Tahlequah. I worked at Hastings Hospital for a couple of years. And then I met my husband while I was there, and he's from the Oklahoma City area, and returned to Oklahoma City and have been here in the area since 2001.
Wow,
yeah.
Fascinating career. Congrats on all of that.
Hey.
Dr. Pinard, how's your morning going?
Pretty good.
And I mentioned that because she's had a bit of a busy morning. If you want to give us kind of a ballpark look at how your morning went.
I did a hysterectomy this morning, a robotic assisted hysterectomy. That went very well.
Good.
And then assisted with a C-section right after that. Scurried out and made my way here.
Well, thank you again for your time. Geez, saving lives and making things happen. And what is your background?
I'm originally from Stillwater, Oklahoma. Went to undergraduate at the University of Oklahoma and medical school at OU, and then did my residency at Baylor University in Dallas, Texas. But missed my Oklahoma roots, and so my husband and I made our way back after residency.
And where are you currently at?
I'm at Lakeside Women's Hospital, practicing both obstetrics and gynecology, and I've been there for about 2.5 years.
Well, February, of course, is Heart Month, and Go Red for Women. Is my dress straight here?
No.
They mentioned this to me before we went live. He's like, Dave, your dress is not straight. I'm like, well, that's the first time that's ever been said to me. But heart disease, it is a serious topic, and give us the facts about heart disease.
It's actually a much bigger problem among women than most women realize. It's the #1 killer of women. Most people tend to think of cancer being a serious problem,
Sure.
and actually heart disease is even larger than that. But the biggest difference among women is that the symptoms may not be the same as what we typically think of for heart problems that a man may feel. Women may have more of fatigue, sleeplessness, things like that, instead of the direct shortness of breath and chest pain that a lot of men feel.
So it's important for them to recognize, important for all of us to recognize the symptoms, but the symptoms in ladies may be a little bit more different than guys.
Absolutely.
And specifically, and this will speak to your expertise, pregnancy and heart disease, and it's important to schedule a pre-pregnancy evaluation. Tell me about that.
The biggest part of going into pregnancy is optimizing your health before you get pregnant. Most young women, thankfully, are very healthy, but some women do have long-term problems, and even problems that they don't recognize exist.
And what's an example of what that might be?
Some people can have hypertension or high blood pressure and not even realize it because they don't see a physician very often. So by establishing care with a primary care physician or an obstetrician beforehand can help optimize your health, make sure that you're doing everything, as best you can before you get pregnant. And if you already have a diagnosed problem and are on medications for that, we can make sure that the medications are okay for pregnancy and that they're at a good dosage for you to help maintain it throughout pregnancy.
Well, even before pregnancy, though, the medication plays into something, let's say that the lady's on birth control. That could be an issue or a complication too, correct?
Yes, and certainly at the time of an annual exam or when a young lady and her family are planning for pregnancy, it's important to establish types of birth control, determine when they're deciding to have a pregnancy, and the decision on what type of birth control can play into whether or not a person has a coexisting disease or a chronic condition already.
Because a birth control could lead to an increase in blood pressure, right?
Certainly, it could.
Mm-hmm.
Okay. And then moving on then, menopause and heart disease. What are some of the things that ladies need to be aware of there?
Well, ladies should just be aware of at the time that they go through menopause, certainly it becomes important to still have an annual exam. I think a lot of times women say, oh, I'm done having children, I don't need to see a doctor anymore, and then there's that lapse in seeing a healthcare provider until they start to get the hot flashes and the vaginal dryness and other signs of menopause. At that time, they may reestablish care, and maybe there are some other concerns at that time, such as high blood pressure or underlying heart disease in another matter. And so it's important at that time to decide if the management of the menopause is acceptable with their condition, or if there will be some increases in heart disease if they consider certain treatments for the menopausal symptoms.
Very interesting. Speaking of that, let's talk about the well woman visits and why that's important. In a nutshell, what is a well woman visit?
It's what we do on an annual basis. We prefer to see people annually. Check in and make sure that they're not having any direct problems related to their menstrual cycles, as well as that they are on the correct contraception that they would like, or if they're past contraception stage, making sure that they're transitioning through menopause well. But in addition to that, we're also doing some general health screenings for them too.
That segues into the next question. What can people expect at a screening?
Blood pressure is one thing, as well as weight, to calculate a BMI and kind of establish if somebody should maybe concentrate on diet and exercise a little bit more. But we also work on screening processes, pap smears included, but as well as mammograms, colonoscopies, and getting people connected if they need to have further screening than that, such as an EKG or any sort of cardiology appointment if they're having issues in that area.
You guys have already touched on this, but if you can kind of underscore, why is it important every year to keep that visit up?
Sure. Well, it's important every year because certain things can happen over the course of a year. It's important to have the blood pressure checked once a year, to have the weight, height. Once a person goes through menopause, their height can actually shrink. That may be the first signs of bone disease, osteoporosis, osteopenia. It's important to get a family history. Maybe last year a family member wasn't diagnosed with something and this year they are, and that could be a genetic condition that this patient should be screened for as well. Also, any changes in medication. There may be some side effects from new medications that maybe a primary care prescribed that the gynecologist needs to know about. So it's just an annual check-in to reassess, refocus, and to take care of the whole person. It may not even be anything medical. Maybe there was a death of a family member. Maybe now this lady is taking care of a grandchild because something has gone on with her adult children. And so not only does she have something medical going on, but she has something that's mental or social or spiritual that's going on that could affect not only her heart health, but just her generalized health.
Interesting and well said. I'm amazed every time I go to my annual check up how things have changed, whether, hey, your blood pressure's up, or hey, get the weight down, lay off the donuts, stuff like that might be affecting it. One last question for you ladies. As we mentioned, it's the American Heart Association Go Red for Women Heart Healthy Month. How does this help out from a medical standpoint to raise awareness, to have a month where people focus?
Just to bring it to attention, and they can analyze what's happened to them in this last year or things that they're concerned about. A lot of times people will come in for their annual exams, but they actually have something on their minds that, well, I'm here for my yearly checkup, but this happened, and it just gives us a chance to reconnect, and they can be aware of what's going on and that how important regular checkups are.
I think it's also important because a lot of times women will put their husbands in front of them, their kids in front of them.
The kids in the family,
The
sure.
kids in the family, the pet. You know, they'll take the dog to get the dog shots, but they won't come in for their annual exam. And I think just having a month to focus on women, and if heart disease is the way to get their attention, then I think that's the way to do it. Whatever it takes for women to just realize, okay, I need to make sure that I'm doing what's best for me. And also, a lot of people don't really understand all the facets of heart disease. They may say, oh, I have high blood pressure, but I don't have heart disease. So just making that connection, reminding people of certain, what they consider common chronic illnesses can be associated with heart disease. And then certainly reminding people eating healthy, exercise. You know, it's recommended that
Getting sleep, right?
Getting sleep, getting sleep. Exactly. Something as simple as sleeping. Exactly.
Because mothers are notorious about, you, like you mentioned, put the kids first, put
Right.
the pets, the husband first, and then they're not sleeping.
Right.
So, all right, Dr. Elizabeth Pinard, Dr. Sonja Hughes. Ladies, thanks so much for the information. Thank you for your time. Congrats on your careers. Best of luck moving forward.
Thank you.
Thank
Thank you
you.
for having us.
More heartbeat and health information can be found on News OK.